So let me just orient you a little bit to Arkansas so you can have an idea where we've come from. Our health literacy initiative in our state has been pushed through the health department. In some other states you have seen the people who get the vision are in literacy, or they might be in a health system. But in Arkansas, it's really been coordinated and pushed through our state health department. And our health department, I believe, is a little bit like in Alabama. We really have a centralized or unified health department. We don't have independent local health departments. The main office is in Little Rock, where I work, and we have 75 counties, and each county has at least one local health unit, some more than one depending on the population. So we have about 94 local health units that are operated by the state health department. We're a little bit smaller than Alabama. We have about 3 million people. We're one of the very poorest states in the nation, and we have a lot of people with chronic illness and disability. We do not have high rates of higher education in our state, and we have very low use of the internet. Part of that is an infrastructure problem, access to it, but also the ability to have a personal computer. Cell phones have helped, but many people cannot afford the smartphones that would use that. Well over a third of the adults in Arkansas have low health literacy. This means people who have basic or below basic health literacy. The rest don't have proficient. It's only about 10% that have proficient health literacy in Arkansas. And we rank very poorly in our overall health. So at the time I got interested in health literacy at the health department, I was director of the Center for Health Advancement. Our health department is organized into 4 centers. The Center for Health Advancement had most of the chronic disease programming in it, the tobacco prevention and cessation program, WIC, family planning, maternity, oral health. So we were doing a lot to try to promote an understanding, engagement of the population of the state of Arkansas. And I made an observation that people were not able to take the information out there, grab a hold of it, dissect it, use it for themselves to make decisions about how they would take care of themselves or their families. And I discovered at one point later on that this is really what health literacy is all about. I've had a long time interest in quality of care. I want the Arkansas Department of Health to have high quality of care that we offer through our local health units, and I want the University of Arkansas for Medical Sciences, which is the main medical school there in Little Rock. We have a new campus in Northwest Arkansas. I was discouraged by the quality indicators that were being measured from the state. And I began to look at what could we do in Arkansas to improve the quality of care in our state. And I came across this report by the Institute of Medicine. This report looked at the types of things that were kind of the low-hanging fruit in terms of what could we do to improve quality of care in the United States. They looked at it in terms of chronic care. They looked at it in terms of acute care. They looked at it in terms of preventive care and then palliative care. And they came up with a number of interventions that could be done in each area, but there were basically 2 interventions that crossed all of them. And one of them was to address health literacy from the point of view of the patient, their ability and skill sets that they needed to manage their own health and health decisions. The other one was care coordination. And when you look at it, that's just the system side of health literacy. How does the system support the people who struggle with these issues, with low health literacy. Because, you know, we can do things to improve people's skill set, but there are a lot of people who will never be able to be proficient in health literacy. So how does the system support those people, treat them with respect, and give them the quality of care that they deserve? So I got interested in health literacy as a result, and I looked at the IOM report that came out in 2004 on health literacy, and I decided that I would do a presentation every week on Thursday morning at 8 o'clock at the health department. We have a presentation, and occasionally it's my turn to give it. So I gave a presentation on health literacy, and I engaged a local pediatrician, because once I got interested, I tried to find other people who were interested. And this pediatrician, Chad Rogers, had been trained in a toolkit that the American Medical Association had put out at that time. So we did a presentation on the problem of low health literacy in Arkansas. And we were fortunate, like you are, that our governor was interested in this and actually sent some people from his office to attend this presentation and was engaged up until he was term limited and left office. So you would think that I had set off what I call a slow bomb. So it wasn't immediate exposure, but it had these huge ripple effects. So that was in 2007, October, and there was sustained interest. People would talk about it, and I would hear about other people. And pretty soon we had a kind of an idea of who all was doing what, or had an interest. And so in the summer of 2009, we decided that we would all get in the same room, kind of like you're here today. And the people who organized it was those of us at the health department who were interested. We partnered with the Arkansas Literacy Councils. We knew other states had been engaged there, and we engaged our literacy councils. The University of Arkansas Cooperative Extension was also very interested, and our Arkansas Children's Hospital. So we hosted a meeting. Children's Hospital put up some money to pay for lunch. We all got in the same room, and we decided we needed to do something that was ongoing. So we called ourselves the Partnership for Health Literacy in Arkansas, and we needed a fiduciary umbrella, so we decided we would become a section in the Arkansas Public Health Association. Over time, it became clear that health literacy was an important aspect of just about anything the health department did. You couldn't do emergency preparedness and tell people what to do in an emergency if the messages you were putting out there weren't understandable. You couldn't promote chronic care management if the messages were not understandable. There were a lot of things like that. So we put together a strategic plan. This was the actual second iteration, and we saw that health literacy is an important part of the things that we needed to do. We're in the process of finalizing an update to this, and the new one will be different because now it's not just something cross-cutting we do. It's actually needs to be something that's integrated in everything we do. So that has its own challenges, but it's moved along so that every goal, objective in the new strategic plan must in some way or another address health literacy. And so we did a lot of talking about health literacy. After I gave my presentation, I had the invitation to talk to other groups. So we did more talks at Public Health Grand Rounds. We have a HRSA-funded Arkansas Geriatric Education Center, and we did health literacy training for those who participate there. Our area health education centers became very engaged in addressing health literacy. At the University of Arkansas for Medical Sciences, they had a Center for Rural Health, which was an entity that supported the area health education centers around the state, and they wanted to be engaged in health literacy, so they hosted our meetings and helped us communicate statewide through video teleconferencing for our meetings for a long time. We have federally qualified community health centers that became engaged because they are there right there on the front line seeing how people struggle with the information out there. And we have something that's unique in Arkansas called the Arkansas Aging Initiative, and Arkansas took part of its master settlement dollars from its tobacco funds and set up a network of geriatric clinics around the state. And part of their role also is to do community outreach. So they were doing a lot of outreach to educate the public and other healthcare providers about geriatric education or geriatric aspects of care, either for themselves or loved ones or for the patients they serve. And of all of the age groups, the age group with the lowest health literacy is older adults. So we had a good opportunity there. Like many states, Arkansas has been struggling with what are we going to do about health care and health care reform, and even before the Affordable Care Act came into play, we had a governor's roundtable on health care, and they felt that health literacy was an important piece of that, so asked us to come and speak with them about that. And as a result of that, other representatives on that roundtable invited us, such as the Arkansas Employers Health Coalition, because they realize that their workers need health literacy. And not only that, you know, we've spent a lot of time talking about health literacy as a problem that people, or low health literacy is a problem when people encounter the health system. But people engage in health behaviors and struggle with low health literacy in other settings too. People struggle with low health literacy when they do their grocery shopping, when they're making decisions about their employees. Employers have to make health literacy related decisions when it comes to what they need to do for their policies and promotion efforts. City government have to do this. State and local representatives, legislators, all struggle with low health literacy when it comes to serving their constituents. So there's, like I say a lot, you know, in Arkansas, we are awash with opportunity when it comes to low health literacy. So a lot of the talks that we gave centered around some concepts. Health literacy is a skill set. It's not just people's ability to read health-related information. It's a skill set in much the same way that computer literacy is a skill set, financial literacy is a skill set. And we tried to get everybody on the same page so we had a common understanding of what health literacy is and what are the implications of low health literacy. And we realized that you can't solve it by just giving people more information, because people don't have the information, the skill set they need to grab hold and embrace that information and dissect it and use it. So it's a bigger problem than just giving health information. And it's not just the individual patients who have a health literacy problem. Our healthcare system also has a health literacy problem. It goes both ways. It's flip side to the same coin. So I use this diagram. This comes from the IOM report on health literacy about the venues or where you can address low health literacy. So culture and society. So we thought about who could help us with that. Churches, nonprofits, many organizations, a good example that just came up to me that I didn't know about. I love it when I hear about health literacy interventions that I don't know about, you know, because that means they're on their own. But someone who is working with in the criminal justice system, people who are on parole struggle with financial literacy and health literacy. And a lot of times they get into financial trouble, and a lot of it's related to their health issues and so forth, that when they need money, they commit another crime and go back. So they're working to support them with their financial literacy and low health literacy. But there's other areas too you can do. The health system we've talked about a lot. The health system has a health literacy problem. We need to help at all aspects. Students, residents, interns, postdoctoral folks, but also the people who work in the system that aren't necessarily the professionals, but the people who are the clerical and the folks that make decisions about how we design our buildings and so forth. Okay, and then the education system. So we were fortunate that Arkansas had an intervention that we called coordinated school health, which was an intervention based on the CDC model, and Arkansas Children's Hospital was behind that. So they made software for health education available to all of the public schools in Arkansas. It was a kind of a internet-based health education curriculum that any school could use that was developed on the principles of health literacy. So there are things like that. One of the things I've never been able to do is I wanted the historically black colleges to have a health literacy course, not just for health professional students, but like a general education class. I've not been able to make that happen. You know, I like to go home and sleep sometimes at night, and so it's just still out there. So one thing that our partnership has done over time is we hosted a day-long conference the last few years. We did not do that this year, and I'll explain that in a little bit. In 2012, we had a person from the South Central region of the National Network of Library of Medicines come and talk about the resources that are available for libraries and the public that are easy to read and in multiple languages. And that way, when people come to the library, the librarians know how to help people get information. In 2013, we talked about how the adult education system can work with the healthcare system to address health literacy. So we had someone from the Florida Literacy Coalition come, we had someone from New York come, and those groups had done a great job of having literacy folks do field trips to the emergency room so they knew how they worked and operated, and they practiced their English, and as they learned English, they were learning health vocabulary and concepts and so forth. In 2014, our focus was on the older adults. We have our geriatric system in Arkansas is very much engaged in this, and we use the What to Do for Senior Health book and provided training, and it went to AARP and a lot of older, in churches that served older adults, teach people how to use this book. And then in 2015, you know, one of the things we kept hearing was the obesity issue and how to help parents understand nutrition, especially those that struggle with low health literacy, because, you know, our health system has failed people. Our health system does not know how to talk to people about food. We do a very good job of talking to people about protein, carbohydrates, and other things, but we cannot talk to people about food. So that's one of the things we were trying to address. We have an initiative in Arkansas with our food banks that takes people shopping and that teaches them, called Cooking Matters, and it helps people learn how to cook and how to shop and gives them the kind of skills they need to get information analyze it, use it in that particular domain. So I also worked in the health department to engage our public health programs. So our chronic disease program, which received CDC funding, was at that time working to engage and empower patients. So we used this Staying Healthy curriculum, which is from the Florida Literacy Coalitions, to empower the literacy councils in Arkansas to get training in health literacy and incorporating it into the curricula that they used. So we had a number of councils around the state. We tried not to keep it all in central Arkansas, use this, and they still have maintained an interest even though the focus of the CDC grant has changed. And our coordinated school health has changed. The model has morphed a little bit over time. So now it's called the whole school, whole community, whole child paradigm. And in Arkansas, what we did was any of the initiatives that we had that were promoting health in school, because everybody thinks we should promote health in school, and they want to do this and they want to do that, and they all don't work together, and it drives the schools crazy, and they don't want to do any of it because they don't have time. And so we worked with the Department of Ed to develop a collaborative partnership. We raised our tobacco taxes in 2009, and we used some of that money to do grants to our school districts to establish a school-based health center. And they must, they get funding for about 5 years, and then they need to figure out how to sustain it. So they partner with whoever is local. It could be a hospital, it could be a community health center, it could be another entity to implement a clinic at the school. And they work very hard to engage the parents and help the staff and the faculty, with wellness and health literacy type of behaviors and interventions so that they can be successful in keeping the children in school healthy and ready to learn. We also at the health department for a period of time had a grant that was through the National Public Health Improvement Initiative, which was to improve the quality of public health. So it's obvious that we need help in that area because the stuff that we put out there is not appropriate for the audience that we're trying to reach. And so we did a plain language QI project, and we used it also to work with our partners, the University of Arkansas for Medical Sciences. We reached the conclusion that in order to do a really good job of addressing health literacy in Arkansas, we needed people with expertise in health literacy. We needed people who knew how it was measured, how it was defined, what the measurements were, what the strengths and weaknesses of those measurements are, and the best way to do that was to engage people in research, because it would be the researchers who would be rigorous in those areas. So we used this grant money to host two summer research conferences on health literacy at the University of Arkansas for Medical Sciences, and we engaged other campuses such as the University of Arkansas at Little Rock, in Fayetteville, Arkansas State University, and so forth. And then we engaged our Office of Health Communications at the Arkansas Department of Health. Because if what we put on our website, which we struggle with, is written at the 16th grade level, what good does that do? And I'm telling you that the stuff that people do that's printed is better. What's on the internet is worse than what's printed. So we really have struggled with that, but we are improving, and now the people who put the stuff at least know to do a readability test on it, and they will send it back to the programs that it came from if it's too high. They also participated in the National Public Health Information Coalition, and I brought a report that we did that we won an award because we had to do a state health assessment, and we tried to write it up in a way using the health literacy principles we had learned, because we figure, you know, if you really want to have impact, you really need to put it out there so people. So we actually won an award for this, and I just have one copy, but it's on our website, but you all can look at it. I'm really proud of it. And our state health commissioner, or we call it the director, said this has been a game changer. He took this down. I have to tell you this. He took this down to the legislature to give them an overview, and they had given him 15 minutes to do it for the public health committee down there. 45 minutes later, he was finished. They were so enthralled with it, and he just had to come and tell me that what had happened. So I think this is really a good thing, this type of report. But you know, not just anyone can do it. It's one thing to be able to look at a report and go, ooh, I don't think that gets us where we want to go. It's another thing to actually get yourself there. That's a whole different skill set. So what we did was to encourage the use of plain language. We had a DRPH student come and do his capstone, and he led a small group that they ended up calling themselves the Plain Language Learning Community. And we had people who were, they said they were voluntold to come to this group. And so they had to come and learn about plain language. And in the beginning, it was kind of like, oh, I guess I have to be here. But by the end of the time, they were all believers, and then they went out into other areas, back to where they were in the health department, and were able to implement what they were learning about. So the idea was to sustain this and keep it going, but we lost staff and we weren't able to do that, I'm sorry to say. But one thing that we did as a result of this is we purchased Health Literacy Advisor software, and we have it in places around the health department. The person that was going to keep the plain language learning community, I don't know why we let people retire. That just shouldn't be allowed, but we did. And so the software is at use in the health department, but it's not being tracked right now. So that's one of our struggles. And so I talked to you a little bit about our health literacy research conferences that we did at the University of Arkansas for Medical Sciences. So we did it one year, and we had heard that the chancellor there at that campus had an interest in health literacy, so we invited him to please come and give the welcoming talk. And that engaged the chancellor in what we were doing. And then as a result of the conference, it was decided that, let me see if I've got this on here, that, you know, this the researchers that we wanted to engage really couldn't afford a couple of days conference. So then we had just health literacy grand rounds. And so we would bring in a speaker. So we brought in Terry Davis and Mike Wolf. And so Terry, can you tell me what happened as a result of that?
Well, the quick story is we just got an R01 to do diabetes self-management in Arkansas community clinics. And Jennifer doesn't toot her horn very well, but she's the little engine behind all of this, who quietly sort of sets it up, who often doesn't get any credit for any of these things. But we were notified like this week.
And how many millions of dollars is that, Grant?
$10 million R01 from the NIH. Mike Wolf and I were invited speakers, then we became consultants, and it was money well spent.
Yep. Okay. So I'm really proud of that. So we use a little money to use the health literacy data and project, if we had county level data in Arkansas, what would it look like. And I'm sure you all know about the Delta, right? Well, this is the Arkansas Delta. And so the counties with the dark green are the areas with the lowest health literacy. So that gives us some ammunition. If you have data, you have ammunition. We've had really good ripple effect in all of this. I mentioned the thing about the the community corrections, all right? Well, we also have had health literacy integrated in professional education. So the University of Arkansas for Medical Sciences has included health literacy in the nursing school. The nurses are the ones that take it up the fastest, I think. The nursing school at the University of Arkansas Fayetteville has faculty now that are engaged. The Arkansas State University in Jonesboro, which is our largest nursing school, the College of Nursing and Health Professions, they have developed 5 online modules which all students are required to take on health literacy. They must complete it. The program they're in determines at what point they must complete it, but they all must complete it. We have a really nice division of interprofessional education at the University of Arkansas for Medical Science, and they made health literacy the focus one year when they engaged all of the students there. So this Center for Rural Health that supports the AHEC, they morphed and went through some changes, and they hired someone that invited Terry. They hired her to come and work with them, and then through the morphing, they established a health literacy program, and then that person wrote a business plan. So now we have a Center for Health Literacy at the University of Arkansas for Medical Sciences that is not in the regional centers anymore. It's under the provost's office. So it's campus-wide. And we have people who are engaged in the research and submitting grants, because really if you are doing research that's related to health behavior and you don't include health literacy, then you will have an unrecognized confounder in the results of your project. And then we're very fortunate in that we have engaged our insurance companies in Arkansas. Blue Cross Blue Shield has been important, Qual Choice, which is a statewide or Arkansas-based insurance, and so forth. It's just been an important part of what we do. One of the things that I think y'all are going to talk about is universal precautions. Well, there's this Health Literacy Universal Precautions Toolkit that we've been trying to acquaint people with. So the AHECs around the state are implementing this toolkit. We've provided training to the clinics that are involved in the Chronic Illness Collaborative. Arkansas is one of the states that received funding from the CMS Innovation Funding. So we have Comprehensive Primary Care Initiative statewide funding, and I think there's just under 70 primary care clinics. So we provided some training to those clinics on the Health Literacy Universal Precautions Toolkit. I called Cliff Coleman to please come and do the training, and he was unavailable, so we had someone else come. But we did this training, and it gets it on the radar screen. It doesn't necessarily get uptake right away, but at least it gets people thinking about it. And the CMS Comprehensive Primary Care Initiative has a stakeholders group, and the stakeholders group this last year decided they had to work on 2 things. Health literacy and the data exchange between like hospitals and clinics and so forth. And I didn't have to say anything. They did it on their own. I talked a little bit about our state health assessment. There's a link here. If y'all get the slides, you can go and look at it online. I do have one copy here. That's been a real game changer because it shows what a good example looks like. It's not just poor examples. So I wanted to talk a little bit about lessons learned. We found that it's important to spend a lot of time discussing what is health literacy, because people have all kinds of ideas about what it is, and to have kind of a common, widely accepted understanding. And that we realize that if we're going to make it sustainable, you need to use the resources you have already and figure out how you can use them differently. Because if you do like a grant or something, when the grant goes away, it's gone. And then we wanted to see, make sure that the partners got out of it what they needed. So it needs to help them do what they're tasked to do better. And we realized that, it's not enough to tell people about the problem of low health literacy. You really need to increase capacity for addressing low health literacy. So a lot of trainings were helpful. And it's important to engage what we call change agents, people who can get involved and they don't have to try to do their job and do this other thing. What they do is they do their job and address health literacy as part of their job, what their sphere of influence is. But I'm finding that a central change agent coach is going to be real key. So we're kind of at a difficult place in Arkansas because I was serving as kind of this change agent, this coach, networker type thing. And a couple of years ago, I took on the role as medical director for immunizations, and I'm sure you all know those have really huge health literacy issues, but it's more than just that. And so I'm not able to devote the time needed to do this. So we haven't come up with a solution for how we're transition yet. I mean, and people move. So we had the University of Arkansas for Medical Sciences Library was hosting our website. The guy who was handling that moved to Houston. And a lot of people we work with get better jobs. I don't know if that's coincidental or not, but and I just noticed like this last week that our website was down, so now I have to go figure out why. But so somehow we've got to navigate this change, so even though we have these various initiatives going on that I don't have to sustain, but that kind of growth and dialogue and collaboration, coordination still needs to take place. And I don't think I can do it anymore. So we're going to have to figure out how are we going to address that. So here's my contact information.